Hi, my name is Manuela Villar Uribe, and I'm a senior health specialist at the World Bank. My project over the last year has been to co-chair the Lancet America's Commission on Primary Healthcare Resilience in Latin America and the Caribbean, while also bringing the perspective of the role and needs of women in building this resilience. The idea of the commission started from lessons learned during the COVID-19 pandemic in the region and a renewed interest from governments and international organizations to invest in chronically under-resourced primary healthcare systems. It is estimated that while Latin America and the Caribbean is home to only 8.5% of the world's population, the region accounted for 13% of all COVID-19 cases and higher than average excess deaths by 2022. Additionally, and very importantly, many countries in the region saw reductions in the utilization of essential primary healthcare services of 40 to 60%, meaning that vaccination rates, antenatal care, family planning, and child health services decreased substantially with important immediate and long-term consequences to the health of the population. An important lesson learned from COVID and other shocks in the region is that the region has not been able to leverage its PHC systems to ensure the delivery of essential services and support response to shocks. When starting the commission, we knew that there would be 4 key policy areas that would be important to strengthen PHC and hence its resilience. Policies on health service and public health, on community participation and empowerment, on multisectoral approaches, and finally on financing approaches. To define these policies, we gathered 18 Latin America experts and commissioners who have been working over the past year to define recommendations for improving primary healthcare resilience. However, to better define the policy recommendations, and especially to understand the role that women play in PHC resilience, we found it was important to develop a simple framework for the effects that a shock can have on PHC and hence its ability to ensure provision of essential services and services specific to the shock itself. In a nutshell, we came to understand that a shock will affect both the supply and the demand for primary healthcare services, and that policies to improve resilience should aim to reduce the impact that shocks have on the supply and demand factors, so as to avoid reduced health service delivery and under-reliance on PHC to provide shock-related services. With women making up the largest proportion of PHC service providers and service users in the region, as well as being the heads of more than half of all households across the region, it has been essential to frame many of the recommendations of the Commission with the lens of women's specific needs. On the supply side, for example, when thinking of provisions to ensure the availability of healthcare providers during a shock, we need to think of what providers who are mothers and heads of households will need to be able to give more time to the increased healthcare needs created by the shock, such as systems to support the care of their children or elderly they might be responsible for at home. On the demand side, for example, outreach specifically tailored to inform women of the availability of and importance of utilization of routine health services for themselves and their children is essential. Leveraging women organizations to guarantee empowerment and trust, creating solutions to access primary healthcare services tailored to women, especially in cases of natural and economic shocks, is essential. Finally, we also have seen increased evidence of the important role that women leaders played in the management of shocks in the health sector. So investing in support systems and policies that can increase the participation of women in leadership positions, especially those related to preparedness, response, and recovery to shocks, will be essential. These thoughts on women's roles in resilience are currently being refined by a subgroup of women commissioners who have been ministers of health, academic leaders, and civil society leaders, bringing their varied perspectives on the needs and solutions. We hope that this will not only result in the recommendations of tailored approaches to resilience, but also a tool to advocate for women's needs and opportunities when investing in resilience in the region. To end, I wanted to quickly thank not only the amazing leaders from which I have learned so much in the Commission, but also WomenLift staff and colleagues who have provided me so much support and excellent ideas and feedback during this process. Thank you.